Merci. Thank you very much. Just want to start off with a couple of introductory comments. With respect to what's in front of us now, I want to lay out some really clear priorities, immediate emergency concerns that Canadians have. First off, in about a week, millions of Canadians are no longer going to have access to CERB. So millions of Canadians who cannot go to work are going to be cut off from the support that they need to put food on the table and to keep the bills, to pay the bills and to keep supporting their families because they cannot go back to work. For millions of Canadians who've been told that they cannot go back to their jobs are not there. Hospitality, tourism, service sector jobs, many people cannot go back to work. And this Liberal government could have brought in legislation in the summer for us to review, to bring in some support for those Canadians that can't go back to work. But what they're proposing instead is going to cut the help to Canadians in the context of a second wave. And that's simply wrong. Secondly, Canadians are still going to work sick because they have to make this impossible choice. Do they stay at home, not get paid, and not be able to pay the bills? Or do they go into work sick and risk exposing their colleagues? And this is an impossible choice for Canadians to make. So our two demands are very clear. We need to make sure that CERB is continued, and the next step is not a proposal like the Liberals have proposed to cut the help that families receive, but it maintains the support they receive. And the second thing is we need to see paid sick leave implemented across Canada so that no worker has to make the impossible choice. Those are our two demands. And I won't be surprised if the Liberal government says lots of good words in the throne speech, but again, those are just words. And we've seen in the past they've said the right things, but not delivered on them. One concrete example is we asked the Liberal government to mention the importance of dental care, and they did, and they said they were going to work on it. And then we had an opportunity to change the tax system to help out those who need it most and ask those who are doing well to pay their fair share. And in that modification that we proposed, there would be enough money to cover a plan to give everyone who earns less than $90,000 dental care coverage. That was an opportunity. We put it on the table. The Liberals said no, and they didn't provide an alternative. So that's an example of saying the words but not delivering on something. Similarly, they're going to say a lot of nice words, but they're not going to deliver on it unless they're forced to. And we're going to say right now, here's an opportunity to do something meaningful for Canadians. Extend CERB, put in place a new program that doesn't cut the help they receive, and make sure every Canadian has access to paid sick leave. That's what we're asking for. Donc, rapidement en français, on a deux demandes. Un, c'est l'importance de continuer la PCU. Pour des millions de Canadiens qui ne peuvent pas travailler à ce moment à cause de COVID-19, ils ont besoin d'appui. Et ce que le gouvernement libéral a proposé va couper l'appui pour ces gens. Et dans mon avis, c'est complètement inacceptable. C'est pas juste de faire ça. Donc, on exige le gouvernement de prolonger la PCU et mettre en œuvre des appuis au même niveau, au même montant que la PCU. Et deuxièmement, on a besoin d'un congé de maladie payé pour tout le monde. À ce moment, on sait que plusieurs personnes font ce choix impossible d'aller au travail malade ou de rester chez eux, mais sans avoir de salaire, avec la peur qu'ils ne peuvent pas rejoindre les débuts. Ça, c'est inacceptable. Donc, on exige ces deux choses. Et je sais que le gouvernement va donner des bons mots dans le discours de Trump, mais dans le passé, ils ont fait la même chose. Ils ont donné des bons mots sans avoir des actions concrètes. Et on a proposé une solution pour livrer une assurance dentaire pour tous ceux qui gagnent moins de 90 000 $. Et c'était un programme. Le gouvernement a dit non et ils n'ont pas proposé une alternative. Donc, un exemple de comment il dit une chose, mais il ne vraiment livré les marchandises. Donc, pour nous, c'est inacceptable de faire ça. Ça, c'est pourquoi on exige du gouvernement de prendre ces deux actes concrets. Et maintenant, je suis prêt pour vos questions. Now I'm ready to take any questions you might have.
We'll now go to questions. We're starting with 3 questions on the phone. Quick reminder to reporter, 1 question, 1 follow-up only. Nous allons maintenant prendre les questions. Commençons par les questions au téléphone. Un petit rappel aux journalistes. Une question de suivi seulement. Opérateur, avons-nous notre première question?
Thank you. Merci. Rapidement, faites étoile 1 pour toute question. Do *1 for questions. Première question, Louis Blouin, Radio-Canada. À vous.
Bonjour, Monsieur Singh.
Bonjour, Monsieur Blouin.
On voit les cas de COVID-19 augmenter. Il y a une recrudescence. J'aimerais entendre vos attentes par rapport au gouvernement fédéral. Que doit-il faire pour essayer de limiter la propagation du virus? Quelles sont les actions prioritaires, à votre avis, pour éviter qu'on retrouve un confinement total, par exemple? J'aimerais entendre vos attentes là-dessus.
Oui, bien sûr. Merci pour la question. Donc, premièrement, on sait qu'avec l'augmentation des chiffres, il y a une grande peur que peut-être on doit encore avoir peut-être des fermetures des travails, des fermetures des milieux de travail. Donc, dans ce cas, avec une deuxième vague, c'est tellement important qu'on a des appuis pour les gens qui peut-être auront besoin de rester chez eux. On a besoin d'avoir d'appui pour s'assurer que tout le monde peut rejoindre les deux bouts. Donc ça, c'est pourquoi j'exige le gouvernement maintenant de prolonger la PCU pour qu'on puisse être on peut être prêt pour cette éventualité potentielle. Deuxièmement, on a besoin de mettre en face sur le financement des soins de santé. Les premiers ministres ont demandé ça. Nous sommes d'accord que le premier ministre Harper a coupé les investissements pour les soins de santé. Le premier ministre Trudeau a continué ces mêmes coupures des conservateurs. Et maintenant, les premiers ministres des provinces disent qu'on a besoin de plus de financement pour livrer les soins de santé pour nos gens dans nos régions. Donc ça, c'est aussi important. Par rapport aux experts, les examens pour vérifier si quelqu'un a COVID-19 ou non, ça c'est aussi tellement important. La distanciation physique, ça reste toujours un enjeu tellement important. Mais il faut qu'on fasse le travail maintenant d'être prêt pour les actes que peut-être on doit prendre, incluant les fermetures potentielles. Et pour ça c'est pourquoi j'exige ces deux choses. Des congés de maladie payés et un prolongement de la PCU jusqu'au moment qu'on a quelque chose plus durable qui est au même niveau, même montant d'argent.
Monsieur Singh, je voulais vous demander par rapport au discours...
Monsieur Blouin, il demande que si je peux répéter la même question, la même réponse en anglais, un instant, et puis je vais prendre votre deuxième question. There is a serious concern about a second wave with numbers increasing. And so that's why we're saying we need to be ready for a potential closure again of workplaces or places of gathering. And in that case, that could mean additional job losses. And that's why it's more important than ever that we make sure there is supports in place for people who will again be told they cannot go back to work through no fault of their own. There needs to be supports in place. And that's why we're saying we need to continue, extend CERB until there's something in place to replace it that actually gives the same level of support. So families are not being forced to go ahead with less. That's really important. Secondly, we want to make sure that no worker has to go to work sick. This is another way to ensure that we reduce the spread so that workers have paid sick leave. That's very essential. And finally, we know that there's general things that are being recommended for us to fight COVID-19. Those things continue: physical distancing, wearing a mask, and making sure we've got enough access to testing. These are some of the things that we need to do our part to fight COVID-19. Oui, et votre deuxième question, monsieur.
Si le gouvernement Trudeau, demain, ne nomme pas un programme d'assurance médicaments, demain, dans son discours du trône, si ce n'est pas mentionné, est-ce que vous allez voter pour, quand même?
Donc, ce que j'ai dit à M. Blouin avec ce gouvernement, c'est ces mots ne correspondent pas avec les actions. Donc, on va évaluer le discours de Trump, on va prendre des décisions de voter oui ou non. Après, on évalue le discours de Trump. Mais pour nous, ce qui est plus important, c'est leurs actions. Et ça, c'est pourquoi je dis maintenant que nos demandes, on a deux demandes qui sont primordiales à ce moment. Prolonger la PCU pour aider les gens. Et deuxièmement, de mettre en place un congé de maladie payé. Ce sont des actes qu'on va évaluer pour vraiment voir si ce gouvernement veut aider les gens.
Opérateur, prochaine question.
Thank you. Merci. Prochaine question. Lina Dib, La Presse canadienne. À vous.
Oui, bonjour. Quitte
Bonjour.
à répéter, bonjour, quitte à répéter un peu les questions de tous mes collègues depuis plusieurs jours, quand vous dites que vous avez ces deux demandes-là, ces deux exigences-là, vous, votre action, ça va être quoi si ces deux demandes-là, ces deux exigences-là ne sont pas livrées par le discours du trône de demain?
Donc, je veux voir ces actions et je vais donner du temps pour le faire parce qu'on sait que le vote pour le trône va être dans quelques journées. Mais je veux mettre l'emphase sur les actions parce que avec le discours de Trump, ce sont seulement des mots sur un papier. Et on sait avec ce gouvernement libéral, avec le premier ministre Trudeau, qu'ils souvent ils disent la bonne chose. Ils ont fait ça dans le dernier discours de Trump. Mais ils n'ont fait rien, effectivement, pour avancer aucun enjeu pour aider les gens qui étaient mentionnés dans le discours de Trump. Donc ça, c'est pourquoi je mets l'emphase sur des actions maintenant, des exigences de faire quelque chose pour aider les gens. Et l'impact, si le gouvernement libéral ne prolonge pas la PCU, si le gouvernement libéral ne met pas en place une congé des maladies payées, l'impact va être sur les gens et ça va avoir un impact sur COVID-19. Ça va avoir un impact négatif. Et pour moi, on a dit qu'on est prêt d'aller à une élection, mais pour moi, ce n'est pas ma priorité. Ma priorité, c'est de comment on peut se battre pour les gens, comment on peut avancer des programmes qui vont aider des gens. Ça reste ma priorité, mais on est prêt d'aller à une élection, mais ce n'est pas du tout mon but. Mon but, c'est toujours de continuer de me battre pour les gens.
D'accord. Mais si je comprends bien, donc, le gouvernement minoritaire va perdre votre appui au premier vote si les actions que vous réclamez ne sont pas devenues concrètes. À ce moment-là, vous voterez contre le gouvernement. Et si j'ai bien compris, confirmez ou corrigez-moi. Et puis mon autre question, c'est au sujet du retour de demain. Est-ce que finalement il y a une entente entre les partis sur la forme que va prendre ce Parlement, le nombre de députés, vote à distance ou pas, parce que c'est dans moins de 24 heures là.
Je commence avec la première question. On n'a pas décidé c'est quoi la ligne rouge, mais je veux mentionner clairement c'est quoi nos demandes. Donc, nos demandes sont ces deux demandes. Et si le gouvernement n'agit pas, on va faire notre évaluation. Mais pour être clair, si le gouvernement propose ces deux choses, on va voter pour ça. On va appuyer ça. Donc, je peux la mettre dans la positive. Si le gouvernement propose ces deux choses, un prolongement de la PCU et un congé de maladie payé, mettre en place pour aider les travailleurs de rester chez eux quand ils ont besoin de faire ça, on va l'appuyer. Mon appui est garanti si ces deux choses sont là. Donc, c'est au gouvernement de décider. C'est la décision du gouvernement s'ils ne veulent pas aider des gens, s'ils ne veulent pas mettre en place un congé des maladies payées. Donc, je mets la proposition dans le positif. S'il veut continuer avec ces deux choses, qui est essentiel, je crois, on est prêt d'appuyer ça. Avec la deuxième question, moi, je suis tellement frustré parce que c'est clair qu'on a besoin d'un système où tous les députés peuvent voter chez eux, peuvent participer dans le Parlement sans aller à Ottawa. Aussi, si on suit les conseils des experts en matière de santé publique, aussi c'est clair qu'il doit avoir une option de rester chez nous, chez eux pour les députés. Et pour plusieurs députés, c'est la meilleure chose à faire pour garder la sécurité de leur région. Donc, nous, comme les néo-démocrates, on va continuer de pousser le gouvernement de mettre en place des mesures pour que les gens puissent rester chez eux. On a exigé le gouvernement de le faire depuis des mois. Et maintenant, comme vous avez dit, à la dernière heure, on n'a pas toujours une décision. Et pour nous et pour beaucoup de Canadiens, on est frustrés avec ça, mais on va continuer. The last one? Oh my goodness. OK, je m'excuse, ils ont demandé que je répète les deux questions. So with the first one, I want to be clear. I want to put the proposition in the positive. We put forward our two demands. And if the government puts forward legislation, makes it clear they're going to do these two things, extend CERB and put in place paid sick leave for all Canadians so that no one has to make the impossible choice, we will support that. So to put it in the positive, those two things are put in place in legislation. We will vote yes for those, and we will support that, and we will move forward. If the government wants to move forward and continue to deliver our vision for a better Canada so we can help people, we will be able to provide support for that. And that's, I want to make it very clear that we are looking for ways to work to deliver what the help that Canadians need is. So that's the first part. And the second piece is I'm also really frustrated that we're just hours away, a day away from being back in Parliament, and there's still so many things undecided. The public health experts' evidence and advice is really clear. We need to make sure that members of Parliament can stay at home, can stay in their ridings, in their communities, and still participate and be a voice for their region. And to do that, there needs to be an ability to vote, to debate, to participate in the fullest way for all members of Parliament without having to come to Ottawa. We know that there's a serious concern about the risk of the spread of COVID-19 with members of Parliament. We already know that it's difficult news to hear, but of course the members of Parliament that we've heard from, the leaders of the opposition, parties that have contracted COVID-19, shows that we need to make sure there's an option for people to stay at home and be able to attend virtually in Parliament. I'm frustrated that we've been asking for the government to deliver a plan to do this for months now, and we still don't have it in place. That needs to be the way we move forward with a hybrid system where members of Parliament don't need to be here in Ottawa. For many communities, the best thing is for them to remain in their ridings to prevent the increased exposure and the risk of bringing COVID-19 back to communities, rural communities, northern communities, in fact, any community, really. So those are my thoughts on those two things. Or those are the English of the French I just said.
Operator, next question.
Once again, please press star 1 for questions. De nouveau, n'hésitez pas à faire étoile 1 pour toute question. No more questions on the phone. Il n'y a plus de questions au téléphone.
We'll now go to questions on the room. I'll ask reporters to make their way to the freestanding microphone. Nous allons maintenant prendre des questions dans la salle. Demandons aux journalistes de se rendre au micro.
Sir, Lee Berthium, Canadian Press. I just wanted to follow up on the last point. You talked about frustration that we're a day away from the speech from the throne. Still no agreement. There was a test yesterday for some parliament that some MPs participated in of the electronic voting system. From what the Conservatives say, it took like 90 minutes to do one vote. Can you speak to that? Is that accurate? And what are the problems with electronic voting right now? And who do you hold responsible for that?
Well, I can answer the last question first. The responsibility lies clearly at the feet of the government. They have known that this is an important thing. They have access to all the briefings that have made it very clear that we need to be able to have a hybrid parliament. They've known this for months. It's not a surprise. It's not like this date snuck up on us. They decided to shut down Parliament. Their shutting down of Parliament led to this date that they chose. So they knew that these deadlines were all of their own doing. And to not have done the work to make sure after shutting down Parliament that we don't have a way to do all the duties of a member of Parliament and responsibilities virtually is clearly the government's fault. And that's why it's so frustrating, is that it's taken so many months of us saying we need to do something so that people can stay in their ridings and participate without risking exposure to their communities. So that's one of the frustrations. In terms of the details, our whip can give you more of the details around what were the problems. But the general feeling from what I'm getting in terms of feedback is that it was difficult and it didn't work the way we had hoped it would work. But again, this is a result of doing things last minute. We need this in place. And again, we're going to continue to push for a hybrid sitting so that members of Parliament can remain in their communities and continue to participate and be the voice for the people they represent.
Given that we're at the 11th hour, what's the likelihood of an agreement between all of the parties? And if there is no agreement, what does that mean for the throne speech, for the confidence vote, for basically Parliament resuming as planned?
Well, this is the frustration. We need to get to work. There's so many things that need to be solved. We know that we're just 7 days away, a week away from CERB ending. And that's for millions of Canadians, their only lifeline. Like that is the only way they can put food on the table because their jobs are just not there for them to go back to. For many Canadians, that is a reality. Because of COVID-19, they can't work and they cannot find other work right now. Because of those folks are worried and they deserve to have some support in place. We know a second wave is imminent or potential. And with a potential second wave, we also need to have supports in place. All these things our worries, and we need to have Parliament working so we can get these things done. And again, we are going to continue to fight to make sure we find a solution, because Canadians need us to get in Parliament to get things passed so that we can get help for them. And again, if the Liberal government had done the work ahead of time instead of just a day before, we could have been in a better position.
Rachel?
Hi, Mr. Singh. Rachel Haynes here from CTV National News.
Hi there.
You talk about the speech from the throne, so I'd like to bring up the Governor General, which my colleague Ashley has reported on extensively as well. How is the investigation going to impact tomorrow's throne speech? Is that going to take away from the messages that the Prime Minister wants to get out, or your priorities, given that the Governor General is facing so many questions?
I think if we take a step back, the questions stem from the importance of having a safe workplace, workplace that's free from harassment, and that's something that, as a leader of a party, I take very seriously. I think all workers across our country, no matter where they work, should be in a safe space to work, free from harassment. So I take that very seriously. In terms of the impact on the throne speech, I think the bigger impact is the fact that the Liberal government has given a throne speech in the past and done nothing with it. They've listed out priorities that we asked for, we fought for, and hasn't done anything with those priorities. I gave the example of dental care. It also applies to pharmacare, applies to the push that we made for affordable access to internet and cell phone services, which, given a COVID-19 epidemic, people have been using their cell phone and data more. All these things were priorities that the Liberal government said that they listened to us and they put in place, but then didn't do anything. So I think the bigger concern, what takes away from the words that the Liberal government's going to present tomorrow, is the fact that they've done words in the past and they haven't backed those words up with action. And that, to me, really is the sad reality, is that they're not actually going to do the things they say, and people are so hopeful about what they're going to say, and they're looking forward to it, and they're thinking this is going to be great. But we know the Liberal government has done in the past, said the right things and not acted on it. So we're giving them a chance. Here are two immediate things. Your first act in government is coming back after shutting down Parliament is to cut the help to people. Don't do that. Instead, extend CERB, bring a plan to keep the same level of support, and let's put in place paid sick leave for all.
So you don't think it's going to be awkward or anything?
I think that it might be awkward. That's a fair way to put it. I think there's a certain awkwardness for the Liberal government. That was their choice, and now there's these very serious allegations.
So my follow-up question also is, you bring up these two demands about extending the CERB and also for the paid sick leave. I'm just wondering, what kind of leverage do you have, though, to get these into the speech from the throne when there are still two other parties who will also be able to support the government, and those two parties are likely not going to want to head into an election, given that both of their leaders are in isolation right now?
Well, I put it this way. I'm not worried about it being in the throne speech. In fact, I'd rather they don't have to mention it in the throne speech. I want to see the legislation. We have a chance now to pass this. I don't want them to signal that they're going to do something. I want them to actually do it. So I'm putting out to the government, if they want legislation passed, we will support legislation to extend CERB so that those families who cannot get back to work can get the support they need. And we are going to support legislation that would put in place paid sick leave for all Canadians, because we know workers need to know that they can stay home if they're sick. So if they want legislation passed in the House, we are putting it out there very clearly. We would support these two things. These are our two demands for Canadians, for workers, for people who are worried about a second wave, who are worried about what's going to happen at the end of September. They need to know that they're not going to be forced to try to get by on less help. They need the same amount of help, and we're fighting for them.
Hi, Mr. Singh. Sources have told CBC News that there have been issues with Madame Payette's treatment of staff at two past positions, including at the Montreal Science Museum. When she resigned, there was severance pay given to her. As well, at the Canadian Olympic Committee, there was two internal investigations. Sources say that in both cases, the government did not ask for a reference from those organizations. Do you think there was enough due diligence done before appointing her to this position?
Well, from the great work that you've done and from what we're seeing in the public domain now with the reporting, it seems that there was not the due diligence done. And again, this is something that the Liberal government should have done. It's their responsibility in taking and appointing a very important position to have done the due diligence. And it seems like, again, they were haphazard in the work that they did in terms of not doing a basic check. Again, that's another example of this government not taking the importance of the position and the importance of the work of government. And that's to make sure you follow through and do the work that's required, the diligence that's required, so they're not respecting the role that they have as government to do the hard work.
The other question is, the Conservatives blame the federal government for there not being more new testing methods approved, particularly compared to some other countries. Do you believe this is a political issue or a regulatory one?
Well, the testing has to be a regulatory issue. It has to be about safety. It has to be only and strictly about what's in the best interest of Canadians. I pause for a second because I don't want us in any way to walk down the path of America. Like, there is no way there should be anything political about following science. And science is making sure we have the best evidence before we put forward a testing mechanism, that it's rigorously tested and it does the job. You know, one of the things that we can rely on in Canada is we believe in our institutions because we've been making decisions based on the evidence. I want to, hopefully this will never happen in Canada, but there should be no politicizing any of the steps we take for healthcare reasons. We might disagree about, Liberals might want to help out their close friends and Conservatives might want to continue to give tax incentives to the wealthy, and we're going to fight for people. We might disagree on those things. But when it comes to healthcare and the proper steps to take before we approve medication or approve testing, that has to be strictly regulatory. But on that point, I have to say that the Conservatives have really shot their credibility with the recent reporting of the fact that a company came to lobby them with a testing device, and then they used that testing device that had not received clearance from our Canadian approval process, and then are bragging that they use this service or this testing. That to me is completely unbelievable. Like, that does not sound like a story that we'd normally read in Canada, that they would go out and brag that they used an untested form of testing for COVID-19 and then say that this is an example of the problems in Canada. That to me is shot the Conservatives' credibility when it comes to making a decision that's not political when it comes to the proper testing of COVID-19.
So I'll check one last time if we have some more questions on the phone. Quick reminder, one question, one follow-up per reporter. Operator, do we have a next question?
Thank you. Merci. Once again, please press star 1 for questions. De nouveau, n'hésitez pas à faire étoile 1. No further questions on the phones.
All right.
Aucune question au téléphone.
I'll take one last question.
Sure, just more of a point of clarification, I guess. Maybe I misunderstood you earlier, but I thought you said you didn't really care if the CERB and your other demand are in the throne speech. You're looking for legislation. Did I understand that correctly? Like, if there is no mention of extending the CERB, it doesn't matter to you? You're looking to the legislation. Does that mean you're going to vote for the throne speech no matter what?
No, we're going to take a close look at what is said in the throne speech. We're going to make a decision on the throne speech based on what's said, the merits of what's said. But when faced with the question, if it's in there or not, do I want to see it in there or not? I want to see it in legislation. Like, I actually want to see it done. I've seen this Liberal government say things in the throne speech and then not do them. And I just want to, again, I'm really emphasizing this point for a reason. Canadians are in desperate need. There are millions of Canadians that cannot work because of COVID-19. They rely on CERB. And the Liberals' first proposal after shutting down Parliament is to cut the help that these families receive. That to me is wrong. So I want to see the actual help to Canadians in legislation concretely. I'm less concerned about them saying it. I'm very concerned about them doing it. And that's what I want to see in terms of one of the things that we would support. If there is paid sick leave for all Canadians and extending CERB for those Canadians who have no other means of working right now, we need to see that support in place in a concrete way. That to me is the most important thing.
And so what does that mean for NDP and the throne speech? What does that mean for your support or not?
Well, if the government puts forward these two things, we will vote for them. We will support it. If they don't put forward paid sick leave for all Canadians and they don't put forward an extension on CERB, then they are putting people at risk. They're putting folks in a position where they don't know where they're going to get the support. And that would be the wrong thing to do. So if they want our support, these are two things that we would absolutely support and vote for. I'm putting out there very clearly, if the Liberal government wants to continue to work with us to help people, we will support these two specific things that people need. right now.
Thank you. This concludes the press conference. Merci. Ceci met fin à la conférence de presse.
Merci, thank you.